I think sometimes, so I do quite a bit of public engagement, and prior to this, this conference, we actually did public engagement up in Aberdeen at one of the shopping centres there. And I think it is still an issue that a lot of people don't realise that type 2 diabetes is a risk factor for Alzheimer's disease. The most recent paper I was reading, it said that there's a 60% increased chance of getting Alzheimer's disease or dementia if you have type 2 diabetes. And so I think for a starter, it's really, really important that people are aware of this. I think we need way earlier intervention. We need to study the periphery more, not just the brain in Alzheimer's. I think we're perhaps missing a lot of information about this disease in the whole body because we have been very focused on the brain, which is understandable. But I think that there are key mechanisms that we're missing whereby type 2 diabetes is driving Alzheimer's disease. And I think what we need to do is, one, we need to have more funding into understanding those the fundamental science that underlies that. We need like I say, more public awareness that people can change their habits to live healthier lifestyles to lower their own risks of developing dementia. We also need to look for better biomarkers of people who have type 2 diabetes that might mean that they're even more at risk of developing Alzheimer's. For example, looking at some of those hereditary genes that you can have that can also increase your risk of Alzheimer's, and looking at, do people have both of those, and therefore are people that really should consider being more aware of their lifestyles. And yeah, I think we need to start thinking about, why is there this link between type 2 diabetes and Alzheimer's? And actually, is there perhaps the opportunity to look for new therapeutics that actually target mechanisms where there's this crossover between these two diseases? So yeah, I think there's so much that we could do in this area. And I think the first place to start is raising awareness so people know that this is an area of research that needs more attention.